Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before we begin, I'd like to thank all those in the province who are finding new ways to celebrate the Lunar New Year. I know this is an important holiday for many people in our province. It's usually a time for new beginnings, big family gatherings, and shared meals. Since that isn't possible this year, countless groups have put plans in place for safe, meaningful activities that respect the public health restrictions in place. From virtual cooking classes to help prepare traditional dishes, to dance performances and virtual family dinners. These examples demonstrate that we can still celebrate important milestones together while staying physically apart. I want to thank everyone celebrating the 2021 Lunar New Year for continuing to prevent the spread of COVID-19. Turning to today's update, we have now administered more than 135,000 doses of the COVID-19 vaccine. More than 42,000 Albertans have now been fully immunized with 2 doses. Over the last 24 hours, we have identified 351 new cases of COVID-19 and completed about 10,000 tests. That puts our current positivity rate at about 3.5%. Looking to schools, there are currently active alerts or outbreaks in 311 schools, which is about 13% of schools in our province. These schools have had a combined total of 897 cases since early January. Of these, only about 155 are believed to be cases of in-school transmission. Currently, there are 397 people in hospital, including 71 admitted to the ICU. Our numbers continue to decline, but there are still as many people in hospital today as there were on November 23rd. This is a reminder that we must keep this downward trend occurring. Sadly, I must announce that 16 new deaths were reported to Alberta Health in the last 24 hours. Those lost to COVID-19 were between the ages of 53 and 97. My thoughts are with anyone mourning the passing of a family member, friend, or neighbor from any cause. We continue to monitor closely for variants and to limit COVID-19 spread in Alberta. I know that many have wondered what the recently announced federal government requirements around international travel will mean for our border pilot and for travelers returning to our province. As you know, in the coming weeks, all travelers arriving at the airport from outside of Canada will be required to undergo a COVID-19 test on entry at the border and to quarantine at a federally designated hotel. Thanks to the testing processes already in place because of our border pilot, Alberta's labs are well positioned to support this new federal requirement. Also, starting February 15th, travelers arriving via a land border crossing will be required to show proof of a negative PCR test completed in the United States within the previous 72 hours. In light of these new federal requirements, as well as the growing spread of variant strains in other parts of the world, when the new federal restrictions come into place, we will be suspending the Alberta border pilot at the Calgary airport. This means that all air travelers arriving to Alberta from outside of Canada will need to comply with the mandatory federal testing requirement and 14-day quarantine period at that time. The border pilot will continue at the Coutts border entry until a decision is made by the federal government on whether additional restrictions are needed at land border crossings. I would like to acknowledge the frontline workers from Alberta Health Services, the Calgary International Airport, the airlines and Alberta Health Services, as well as the University of Calgary, for helping to make this pilot a success. I also want to reiterate the important role that this border pilot has played in the last 3 months in preventing the spread of COVID-19 in the province. Outside of the border pilot, individuals who return from traveling internationally are required to quarantine in their homes when they come back to Alberta or anywhere else in Canada. They would not typically be tested unless experiencing symptoms during their quarantine. The result was that only a small proportion of returning travelers were typically tested on arrival. Under the border pilot, since November, we have been able to test more than 49,000 returning travelers as soon as they arrived. The positive cases identified from this testing have included many who were not showing any symptoms. We have also been able to screen all positive cases from this pilot for variants, helping prevent them from spreading widely. We will begin the policy work with the federal government and local partners, so Alberta has a plan to replace the current requirements well before they are set to expire, and to ensure the safe restart of travel when the time is right. Finally, I'd like to end today by asking all Albertans to be extra safe during the upcoming long weekend. Tomorrow is the start of the Lunar New Year, Sunday is Valentine's Day, and of course Monday is Family Day. In a typical year, we would be spending this long weekend gathering with our closest family and friends. In fact, we'd all be encouraged to gather and cherish the chance to connect. However, this is anything but a typical time. Just like other recent holidays, we need to celebrate this long weekend differently. This year, I'm asking Albertans to celebrate by staying close to home and connecting with their friends, family, and community in other ways. By not gathering together in person with individuals outside our household, we're not giving COVID-19 a chance to spread. If you plan to meet someone, do it outdoors with no more than 10 people, staying 2 meters apart at all times. I know that many people want to gather with friends and extended family in restaurants and inside homes, but that is still against the rules. Our numbers are declining, but this virus is still here, and cases can rise quickly if given the chance. By choosing safe activities and by making safe choices that prevent the spread, we can all keep cases and hospitalizations trending downwards. This is the best way to keep ourselves, our loved ones, and our communities safe. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. What is your position on lifting restrictions in some parts of the province sooner than others based on case counts?
I know that there is keen interest in a more regional approach, and yet when we look at our numbers, we see that every health zone is still over that limit of 50 cases per 100,000 that we had been using in the summer and fall to navigate our relaunch. So while some zones may have less cases than others, all zones continue to have a level of cases that continues to be concerning. And our towns and cities are all interconnected. We know that Albertans travel from home to work, sometimes across long distances. We know that people shop in nearby cities, even if they live in small towns. And we know that that level of interconnectedness can cause rapid spread of the virus when one person is infected, and it can quickly spread to others. So at this time, our restrictions are in place provincially, and we are pursuing this path forward in a provincial way, given that we continue to have those concerning levels of cases across the province.
Operator, could you put through the next caller, please?
Next is Rafi Bujikanian with CBC. Go ahead, Rafi.
Hi, Dr. Hinshaw. Back in April of last year, the Premier told Power and Politics that he was asking Alberta officials to try and look for their own rapid tests for COVID-19 because of the slow trickle from the federal government. We're now seeing Alberta's only used 0.89% of the supply it has received. I'm wondering, why is that number so low, and do you expect that to change with the newly announced pilot program?
When the rapid tests began to arrive in the province from the federal government procurement in the fall, we employed those using the licensing parameters. So the tests that we received were licensed for use in those who had symptoms. And so we have rolled them out across the province for use in rapid diagnostics, and that has been very helpful, particularly in remote or rural locations or in outreach locations. Since the expert panel nationally released their report indicating that there is sufficient evidence to indicate that regular screening using rapid testing in defined populations can potentially be a benefit when added to additional public health measures. We have been moving quickly to create additional capacity within multiple locations to be able to use these rapid tests for screening purposes. And I anticipate that the proportion that we will be using will be increasing in the weeks ahead as we roll out those screening programs in accordance with that expert panel recommendation that just came out several weeks ago.
Operator, could you put through the next caller, please?
Next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Audrey, I think you're on mute.
Hospitalization. I'm not. Hello, can you hear me?
Yes,
we can now,
Hi,
yep.
can you hear me? Okay, thank you very much. We're seeing this trend going downwards since the beginning of the week on new cases and especially on hospitalization. Since Alberta began its first phase of lifting restrictions. I want to know if you expect this trend to continue going downwards as we open up, and are you surprised that we have already gone under the 450 hospitalization cases that we need to go forward potentially with phase 2?
We know that hospitalizations are responding to case counts that happened 2 weeks ago. So as our case counts have continued to go down, which is a great thing, our hospitalizations have also continued to go down, which again is a very good thing. We know that with case counts, if our case counts start to plateau or begin to rise again, our hospitalizations will take several weeks before their trend starts to change. We know that hospitalizations are a lagging indicator, so that extra time is needed. And while we have already reached that 450 below 450 mark that's required to move to step 2, that's only one part of the requirements. The other part of the requirements is that we manage to hold our new cases at a stable or declining rate, despite the activities that are now allowed by moving into step 1. And we will need that 3-week time period to assess and monitor those trends. So the question about step 2, certainly we've achieved that one metric, which is again very good news. And now we need to collectively achieve that second metric by continuing to follow the public health measures in place, even with these new activities that are now allowed under step 1.
Operator, can you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Since late December, Albertans have been told that decisions would be coming soon on phase 2 of vaccine rollout. The federal government is confident the country is on track for 4 million doses by the end of March. Other provinces have released their phase 2 plans despite the issues with vaccine supply. And health policy experts say there needs to be transparency, and the lack of detail is creating a vacuum for Albertans. How come Albertans are still waiting to learn what the public vaccination campaign will look like? And how do you explain this lack of detail and transparency to Albertans?
The decisions around phase 2 are, of course, very important ones, and they cannot be taken lightly. Certainly, other provinces have released their plans for phase 2, and we are continuing to have discussions about those very critical elements of what sequencing will look like. Final decisions have not yet been made, and again, the importance of taking time to make sure that all of the different aspects of sequencing and the options are considered has been causing the length of time that has been taken on this. But I anticipate that there will be some decisions made within the coming weeks, and I know Albertans are keenly awaiting that information.
Operator, could you put through the next caller, please?
Next is Matt Woodman with CTV. Go ahead, Matt.
Hi, Dr. Hinshaw. Manitoba announced today they have secured 2 million doses of a Canadian-made vaccine. Is Alberta considering taking the same step, or have you already considered taking that step?
Of course, all of us are interested in vaccinating and securing supplies for vaccinating our population, but decisions around vaccine procurement and the options that might be available are not my decisions, so those questions would be best referred to the Minister's office about what deliberations, if any, have been undertaken with respect to extra procurement from Alberta.
Operator, can you put through the next question, please?
Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. Thanks for taking my question. We've jumped to 156 variant cases from 120 yesterday, according to the update online. Is that our largest 24-hour jump? And what is your concern level? How many of the total cases are non-travel related? And do you believe enough is being done to curb this growth?
That is our largest 24-hour increase. And the testing numbers go back up to around the beginning of February. So what we've done with testing all of our positive cases, as you may know, there are many labs in the province that do the COVID test. And so whenever there is a positive result on a COVID test, that sample is shipped from the lab that does the original test through to the reference lab. And they are then doing the screening on the variants. And the lab has done an amazing job at ramping up their testing, but sometimes the time between that original test and that screen can be a bit delayed because of that transport time. And so what we've seen again is several days worth of testing that have come in all at once. The total number of cases that are not travel related at this time is 93, but what I would say is that many of those are the cases that we have found when we've been doing our intensive follow-up of cases, double testing close contacts, and the majority of those cases are cases where we know about those transmission mechanisms, where we have identified those and then put in place the boundaries around those or the interventions around those to prevent further spread. So as I've said before, the important part about knowing about these variant cases is that we can then prevent further spread. And again, want to make sure people are aware that the additional cases that are being reported today are cases that were detected over about a 1-week time span.
Operator, could you put through the next caller, please?
Next is Daniela Germano with the Canadian Press. Go ahead, Daniela.
Hi, Dr. Hinshaw. I wanted to ask about the special syringes needed to extract the 6th dose from the Pfizer vaccine. You had mentioned before that Alberta still had those syringes, but could run out soon. Has the province gotten any of those syringes from the federal government yet? And how are we in terms of supply right now with those syringes?
It's my understanding that we have received a shipment of those specialized syringes from the federal government. And with respect to supply, again, at the moment, I believe we have a good supply of those syringes, but Alberta Health Services would have the details on inventory and use volume, so that's something that we can follow up with Alberta Health Services on.
Operator, can you put through the next question, please?
Next is Lauren Poland with Global Calgary. Go ahead, Lauren.
Hi, Dr. Hinshaw. Just hoping for a bit more on the new variants. Are you able to tell me if there's been any changes to in-school transmission or cases at schools? Are we still at 7 classes in 6 schools? And I think that's it. Thank you.
With respect to school transmission of variants, the information in terms of confirmed cases is the same as yesterday. And investigation does continue at that one school where we have identified an incident with transmission. So there may be some additional cases in that school in the days ahead as that investigation continues. But I don't have all the details at this time. And of course, the important thing is that measures have been put in place now to prevent any further spread. But it's important to remember that because of that incubation period, that with the exposures that may have happened earlier, we could still see a few cases, which does not mean that there is ongoing risk at that school, but rather that we're able to detect those cases and prevent them from any further spread.
All right, there's just one question left in the queue, so operator, put through our final question, please.
Final question is Tom Ralston with Global Left Bridge. Go ahead, Tom.
Hi, Dr. Hinshaw. Thanks for taking my question. We've seen urban versus rural COVID-19 case comparisons this week, but I wanted to ask today about a city-to-city comparison. As of Wednesday, Lethbridge had recorded 1,843 COVID-19 cases. Meantime, 2 hours down the highway in Medicine Hat, there have been just 536 to date. Is Alberta Health aware of any factors that would explain why the numbers in two similar-sized cities are so different? And if not, what factors do you think could be at play?
So I don't have the specific stats on Lethbridge and Medicine Hat in front of me, but of course, as you referenced, they are available on our public dashboard. We know that there's many factors that impact the number of cases that are diagnosed. Of course, the amount of testing that's done in a particular location can impact the number of cases that are diagnosed. Transmission is obviously impacted by the number of people who are in close contact with each other. We also know that spread can happen quickly in communities that sometimes have inadequate resources, where there may be overcrowding, many people in the same household. And so I'm not sure if any of those factors are contributing to the difference between Lethbridge and Medicine Hat. Those are some of the factors that we have seen in other locations. But ultimately, we know that where there's an infectious case and opportunity for it to spread, it will spread no matter where. There's no part of our province that is protected from COVID-19, unfortunately, at this time. And so despite the fact that there is that difference in diagnosed cases, that risk still exists, and everyone in the province does still need to follow COVID-19 measures.
Thank you all for joining us. Dr. Hinshaw will provide another update on Tuesday afternoon. Have a safe long weekend.